Hello, my name is Kaylee, and this is my RN interview reflection. I recently had the opportunity to interview an incredible registered nurse who shared their journey, insights, and experiences with me. This reflection will walk you through what I learned and how this conversation has helped me better understand the nursing profession and what it takes to truly thrive in it. Completing this interview was both exciting and also slightly nerve-wracking. I reviewed the questions in advance so I was prepared, but I wasn't entirely sure of what to expect in terms of responses and how the RN would feel about me asking these personal questions. I initially felt the most nervous about the interview process feeling awkward, as I've never really done anything like this before. But as our conversation progressed, I began to feel more uncomfortable and engaged while listening to the RN's responses. The RN's responses were thoughtful and detailed, which made it easy for us to have a meaningful discussion. It also helped that the RN was very open and honest, which made me feel a lot more comfortable. Throughout the interview, I focused on summarizing points made by the RN and adding on smaller questions to ensure that this interview felt more like a flowing conversation between us rather than just a Q&A. I also utilized nonverbal communication like we've learned in class, using things like nodding in agreement, eye contact, and keeping a relaxed but professional posture, which helped ensure that this was a safe space for the RN to share her experiences with me. To start off, I asked the RN about their educational journey, and interestingly enough, the RN did not begin her journey with post secondary in nursing. They were enrolled in an elementary education program, and after a year or so, realized that their passion laid elsewhere and wanted to transfer. So they transferred into the Bachelor of Nursing program, completing their 4-year degree, and passed the NCLEX to officially start working as a registered nurse. This related a lot to me as I'm currently a kinesiology student transferring into nursing in the fall. The RN I spoke with works currently as a nurse manager at a non hospital surgical dental facility located on an Indigenous reserve. They have a diverse background, which includes working in labor and delivery, internal medicine, and now taking on a leadership role in surgical care. As I mentioned, over the years, they've worked in a variety of settings. However, they've never pursued extra certifications yet, but they do maintain having active BLS, PALS, ACLS, and other credentials, and they're committed to continuous learning through other resources and self-directed studies. As a nurse manager, her day to day responsibilities were incredibly broad, being in charge of things like onboarding new staff, reviewing policies, doing emergency drills, overseeing patient satisfaction, chart audits, and managing the entire schedule. And on top of this, they're also doing direct patient care, everything from pre anesthetic consultations, PACU monitoring, and discharge teaching. What stood out the most to me was the commitment to equity and inclusion. Since their facility is on an Indigenous reserve, they emphasize the importance of cultural sensitivity and how often they utilize other methods. Some of the things that they use when presenting with language barriers is tools like Google Translate or involving family members when language barriers do arise. They also always make sure that the patients understand the treatment fully before providing consent. This is really important to me as in class we learned about using a translator, but it's good to know other options in case a translator is not present. And it really felt important to key in on making sure patients are aware of what they're signing for and what treatment they're receiving, regardless of a language barrier. Hearing the RN talk about work brought a lot of course content that we've learned to life. For example, in class, we talk about nurses being advocates, but it was this real world example that really drove the message home for me. So the RN described a time on night shift when they had a patient that was slowly deteriorating, mentioning they were becoming drowsy, breathing was harder, and visible signs of needing more oxygen. The RN contacted the junior resident on call who did not think that calling for a code 66 or ICU support was necessary, and when the RN reached out to the senior resident, there was no response. So, despite concerns about stepping on toes, the RN did ultimately make the decision to call the code, and the ICU team responded and transferred the patient for care. This story really hits me because it showed how critical it is for nurses to trust their instincts and speak up, even in situations it might be uncomfortable. It was their courage that probably saved this patient's life, but it also highlighted the importance of communication and interprofessional collaboration. The RN mentioned that afterwards there was a debrief with the management team and the residents to improve future communications, collaboration, and overall working together as a team. And the RN mentioned that this debrief significantly helped in the future. The RN's leadership also extends beyond just clinical care. Currently, they work close with anesthesiologists, dental operators, other RNs, and infection control officers to build and improve systems. They also mentioned consulting with medical directors on everything from equipment needs to staffing concerns. And it made me realize how much nursing leadership is about creating a safe and well-functioning environment for both patients and staff, which is not done without proper communication. Another major takeaway of mine was the commitment to inclusive care. They emphasize clear communication, as I've mentioned, but also a culturally competent practice and patient advocacy to ensure that we're aligning with what we're learning about in class about social determinants of health. It reminded me that nursing's not just science and textbook readings, but it's also about the relationships you build and mutual respect. In terms of professional development, the RN mentioned that they do stay up to date with regular reviewing of guidelines and self-directed courses, but they haven't pursued any additional certificates yet. However, it was inspiring to me to know that there is so much self-directed options you can take to continue your learning. It's really important to recognize that nursing's not just a one-stop shop and that you're going to be constantly growing and learning within this career. And that's something that really aligns with my values of constantly wanting to improve and do better. This interview made me reflect on how my future in nursing is one of the things I now understand more clearly is how many different roles a nurse can play. From bedside care to leadership, education, and advocacy, nursing offers so much variety. The RN also gave me some great advice to future nurses, and it was really meaningful to me. They encouraged building strong support systems with like-minded peers, utilizing things like study groups, and taking full advantage of clinical experiences. Even in the clinicals that maybe are not the most interesting, still utilize them to the best of your ability and really emphasize curiosity and asking lots of questions to your preceptors. The RN also strongly recommended getting hands-on experience, either as a nursing assistant or an undergraduate nurse position, and that made me realize how essential that could be and how important it is to seek out learning opportunities beyond just the classroom. And this is definitely something that I am looking to pursue once I start the nursing program. The nurse also shared how hard it is to manage work-life balance, which I think is crucial in such a demanding profession like nursing. They focused on things like prioritizing physical health, healthy eating, and time with loved ones. It was a good reminder for me that if I take care of myself, I can better take care of others. Also, they didn't sugarcoat challenges of this career either. Things like doing shift work and burnout, staffing shortages, and safety concerns were all mentioned. But even with these obstacles, the nurse said that it makes a meaningful impact on patients' lives, all worth it. And I agree that sometimes the short-term struggles are just long-term learning opportunities. It also made me realize that as a nurse, I want to be sure to show up and make sure that I'm present at work. Overall, this experience has deepened my appreciation for the complexity and humanity of nursing. It reminded me why I chose this path to begin with, things like supporting, serving, and growing. I'm more excited than ever to pursue a nursing career, and I'll carry the lessons from this interview with me for the rest of my nursing career. Thank you so much for listening to my reflection.